All right, so let's start with the clinic. Tell me what you like about working with residents in the UTPB clinic.
That's great, Dr. Swales. I love working with residents, and I'd say all of my colleagues do as well. So it's an integral part of the clinic. Residents are there for all the sessions, for the maybe not every single session, but for most of the sessions they're there. So most of the faculty are very used to working with residents. They love it. The patients love it. We're actually getting comments from patients in person and also on our own reviews that are online about great experiences that they've had with residents. So that's really great to see. So, in the clinic, when we have residents, we're trying to, combine clinical care and education. And it's pretty seamless because the residents are there to learn about outpatient care, and they see the patient first, and they take the history and the physical, the proposed plans, they put in orders, and they check out with the attending. The attending most of the time goes in there with the resident as well and discusses things with the patient, and we discuss as a three-part kind of partnership, maybe more if there's family members there. So I love to see residents develop. It's really great to watch them come in as green interns. And then by the time, the end of their third year, I look back like, wow, they've really matured. They're so much smoother now. They're more confident, but they also, as they learn more about medicine, they know what they don't know, and they get better at looking up things and identifying areas where they need to improve, not only in patient care, but in systems-based practice. So I think that's really just the best part. I can say that the time goes by really quickly. It's like a blink of an eye. All of a sudden, my former interns are second years and third years, and it's great to see them develop. So yeah, each attending has different styles on how they work with residents, and I think it's good for residents to be exposed to that, so they're not just working with one attending for the entire 3 years. They can learn about how one attending does things and kind of adopt their own practices there. And we try to give every opportunity for residents to get involved in patient care.
What's the patient population like at the UTPB clinic?
It's a wide mix. We have a lot of Medicare, a fair bit of Medicaid patients. A lot are on commercial insurance. We also see people who are employees or students or staff at UT or Lamar Herman, especially at the Texas Medical Center. But also just patients from all over the city. They come in for primary care or specialty care. And we do have some patients who struggle with financial issues, and fortunately we do have case managers and team members to help them find resources. So it's a wide mix. And then when I give orientation to students and residents coming through, some patients are here. They have a few issues, but they're here just for a physical, and they're generally feeling well, all the way to very, very complicated patients who are seeing multiple specialties and have a lot of social needs that impair their ability to access care and to put plans in motion. So we try to help out with all of those patients.
What's your favorite thing about the residents here at UT?
My favorite thing about the residents? It's hard to pick one. I'd say they're all smart, they're dedicated, they're really nice, they're laid back. Even when they're really, getting, really, paying attention to really small details and important things in patient care, they're still all very nice and collegial. They laugh and have a good time, while at the same time, taking care of the patients there in the clinic. And so all very respectful. I love them. I can't really think of any single resident that I don't like to work with there in the clinic. They all have different approaches too, so it's interesting to see how they develop over the years.
And then tell me how you ended up at UT. What has your career been like, and what have been the things that you've appreciated about our institution over the years?
Yeah, so this gets into some other things I think we were going to talk about. So I started here as a fellow here at UT. I have lived on and off in Houston and other parts of the country, so I consider Houston my home. And I first landed at UT doing a 2-year general internal medicine fellowship. I love the people I was working with. I really enjoyed the outpatient practice that I started to establish there. I like the opportunities to get involved in research and other projects like educational projects and quality improvement. Um, so I love not only my colleagues but my direct supervisor, Dr. Phil Johnson, and so it was a natural fit. I wanted to stay here. I'm grateful that they let me stay on. I've done a number of things here at UT, involved in a lot of quality research, quality improvement research administration, and also continuing to expand my outpatient practice.
And so tell me about the fellowship program. Why did you decide to start it, and what do we offer to our fellows here?
Well, we decided to start it because, Dr. Phil Johnson and I had a shared vision to provide opportunities for, uh, young physicians, not necessarily young in age, but young in their career, to explore opportunities to develop in academic pursuits for education, research, quality improvement, administration. I recognized from my own time in the fellowship that it was a really great thing. I wasn't sure what I exactly wanted to do after residency, and I didn't even know what a general medicine fellowship was. And when I learned about it, it was a little bit strange, the concept to me at first, because you go through 1 or 2 years, but you don't get a board specialty certification after that. But as I learned more about it, I thought, wow, this is a great thing, and I want to take advantage of it, and we want to offer that opportunity. So what we offer is a 1 or 2 year fellowship. You get protected time to pursue things in education and research, and we have a lot of programs available here that we can connect fellows to depending on their own interests. Of course, fellows are expected to be clinically active in the inpatient and/or outpatient side as well, and then use that as a foundation. The connections and the projects you get involved in, the mentorship, to use it as a foundation to jumpstart a career. And, they can take any fashion. Not everyone necessarily would need to go on to or want to go on to full-time academia afterwards. But there's so many ways in which having a protected 1 or 2 years with some patient care, but time and availability to pursue other academic pursuits can benefit someone. And so that's what we want to offer to our prospective fellows.
And what kind of careers have previous fellows gone on to enjoy?
Well, so this particular fellowship is pretty new. So our first fellow started in the fall of 2020. The fellowship that I was involved in, I can say that a lot of my colleagues have done great things. There was a fellowship here at UT as well. I'm not sure if I should name names and get specific, but one's a director of the state health department in one of the states in the U.S. Another one is the CEO of I guess, our Harris County hospital district, and others are, another one's here at UT with a burgeoning pediatric practice, and other folks are doing all sorts of other things. So I'd say that I'm really proud of my colleagues who have gone on to do those things, but it's not necessarily geared to people who definitely want to do administration and healthcare system leadership, although it can help prepare people for those careers if they want to do that.
And then if you're comfortable, would you just tell us a little bit about yourself outside of work so the applicants can get to know you? What are you interested in? Do you have any hobbies? What do you like to do in Houston?
Yeah, great, thanks. I love to eat out in Houston, and I hope to get back to doing that, to pre-pandemic levels once everything calms down. So me and my family love doing that. I'm married. We have 2 kids. We live in Sugar Land. We love to travel, but we haven't been able to do that much. I like to read and write, things that I need to get back to doing more of, but that's what I like to do. I like to exercise outdoors as well. So nothing really exotic, but just, I like to relax with my family and spend time with them.
Wonderful. Anything else you think our applicants should know about our program, our clinic? Anything else?
Yeah, I don't know if it really came through when I was describing all this, but I would say that I think one of the things that I really like about UT are the wealth of opportunities to pursue interests. There's the medical school. We also have the School of Public Health and School of Biomedical Informatics and the nursing school. Of course, Dr. Swales as the director of interdisciplinary efforts here. You're well acquainted with those opportunities, and it's great to talk with faculty and other folks at those schools to learn more about projects like informatics projects or public health projects, even working with the nursing school as well. So people are very open to collaboration. People are very laid back, but you can really get plugged into a lot of interdisciplinary projects. So I like that a lot about UT.